Okay, so now we're going to talk about interferential current, or commonly known as IFC, and that's how we can document it in a SOAP note, is IFC. It reduces pain and swelling. It's more comfortable, affects a larger area, and is longer lasting. Those of you who are doing your research study on electrical stimulation might find articles comparing IFC to TENS, and you can let us know what you found with that. It's composed of alternating currents. The pulse duration may not be changed. The wavelength is inversely proportional to the carrier frequency, and so we'll talk about that a little bit here. So here you have circuit 1 of 5,000 hertz. Okay, so that's your frequency, or your carrier frequency, we call that. Circuit 2 has 5,100 hertz. So the difference between those two is 100 hertz. So if you combine the two together, you get this interferential current, and you get this 100 hertz right here in the middle of, and that's what they're talking about. So here's our placement. So you have two channels. Let's say the area that we're wanting to stimulate is right here. So let's say it was on the knee or the anterior shoulder. So you're going to have one channel, channel 1, which has the two A pads, are going to go through this way. Channel 2, the B pads, are going to go through this way. So you have 5,100 hertz this way, 5,000 hertz this way, and then that 100 hertz is going to intersect right there in the middle of that X. And that's the area of treatment from those two summation of those currents of channel 1 and 2. So when you're setting your electrodes, when you're using IFC, it's going to be very different than when using other kind of electrical stimulation, because you're going to cross those paths and you're going to know that the intersection in the middle is where your treatment is. So you want to make sure that you're placing the pads accordingly. So like let's say on the shoulder patient, they're trying to get the treatment right here. So channel 1 is going to have one here and one up here. Channel 2 is going to be here and here. It's going to intersect right here. Okay? With this one on her leg, here's channel 1 here and here. Channel 2 is here and here. So the area of treatment is therapeutically is all in here. Okay? And you can see they've spread this out past 2 inches on both sides. So you've got a very large area that they're going to treat with her. And this is just, again, showing the lines of the current and how that works. And that's what makes it interferential, makes it different, but it's definitely more comfortable. You don't need as much intensity in order to get the same therapeutic effect. So we use it for pain relief, low back pain, osteoarthritis, postoperative management of knee surgeries. They do use it for urinary stress incontinence and for myofascial trigger points. Contraindications are the same, those cardiac pacemakers, that active bleeding, malignancies, disoriented patients, pregnancy, overcarotid sinuses, active infection in an area to be treated, sufficient distance between the electrodes. We want to monitor the skin, over aesthetic skin. We talked about those post-op patients, superficial metal implants, you want to be careful. Short duration decrease in arterial blood pressure with pelvic floor stimulation can cause some issues. You want to be cautious of that. Over open wounds, extreme edema, areas of heavy scarring for the same reasons with the other E-stems. Same with the pharyngeal and laryngeal muscles in the carotid sinus. The corticosteroids, again, you're going to let me know what you think about that. And stimulations transthoracically. And so that's where, like, you're going to put those pads on either side of the spinal cord. And so you want to let me know what you think about that, whether you think that's a safe thing or not. Okay? We can also use electrical stim for tissue healing. This is where we're going to tend to use more of a high volt pulse current. So I'm going to stop right there.